Choosing the right prenatal vitamin is one of the most important steps you can take when preparing for pregnancy. Whether you're already pregnant or planning to conceive, a well-formulated prenatal supports both your health and your baby's development. A high-quality prenatal provides full spectrum support of essential nutrients your body needs during pregnancy. It supports healthy fetal development, especially the brain, spine, and organs. It also reduces the risk of neural tube defects thanks to activated folate. It boosts your energy and it helps to reduce fatigue by supporting red blood cell production and metabolism. A high-quality prenatal also helps to support your immune system, helps maintain hormone balance, and promotes bone strength with vitamins and minerals such as calcium, magnesium, and vitamin D. Here's what I look for when selecting a high-quality prenatal. I personally prefer a multi-capsule per day approach, which typically looks like taking one capsule 2 to 3 times per day as it spreads the nutrient absorption throughout the day. This helps your body to better utilize and absorb the nutrients. It also avoids overwhelming your system with a large one-time dose, and it helps keep nutrient levels more stable. Now that said, in the first trimester, when nausea and food aversions are common, a 1-a-day prenatal may be more manageable, and that is totally okay. But by the second trimester, I usually encourage switching to a multi-dose prenatal, especially if it's well tolerated. I also always choose a prenatal with methylated B vitamins, especially methylfolate and methylcobalamin, which are the active forms of folate and B12. And the reason for this is that these forms are better absorbed and utilized by the body, and they bypass the common genetic variations that can affect B vitamin metabolism and then contribute to neural tube defects. Now, let's talk about the iron situation. Most prenatal vitamins include iron, but here's the catch. When iron is combined with calcium and other minerals, its absorption gets greatly decreased. So if you're someone who is low in iron or anemic, I always recommend taking iron separately from your prenatal. And I often avoid prenatals that include vitamin A, particularly in the form of retinol, or it says vitamin A, especially in the first trimester. So vitamin A in high dosages can be a teratogen, meaning it can interfere with fetal development, and it can increase the risk of birth defects if taken high dose. And if there's no way around vitamin A, then I prefer the beta-carotene, which is a plant-based form that converts to vitamin A only as needed, reduces the risk of toxicity. However, I much prefer clients to aim to get their vitamin A from food sources and to not take it in supplement form if possible when trying to conceive or pregnant. Now let's talk about omega-3s. Omega-3s, especially the DHA component, are essential for your baby's eyes, brains, and nervous system development. And they also support your mood and help to reduce inflammation and may actually lower the risk of preterm birth, and it's found in some studies. Most prenatals don't contain enough omega-3 if it is included, and that's typically why I recommend supplementing with a fish or algae-derived omega-3 separately from the prenatal. And then the last essential nutrient I'm going to talk about today is called choline. Choline is vital for the fetal brain and spinal cord development, and it actually can help to lower the risk of birth defects as well. It may also help to improve pregnancy outcomes by reducing the risk of preeclampsia, preterm birth, and potentially low birth weight. Pregnant women need about 450 milligrams daily of choline, and to actually get this through the diet, you would need to eat about 3 eggs per day. And if your prenatal doesn't include choline, and most don't, you can supplement with it separately or boost food sources like eggs, chicken, and broccoli. And when it comes to starting a prenatal vitamin, I often recommend starting at least 1 to 3 months before trying to conceive, if possible. This helps to ensure your nutrient levels are optimal before the baby's earliest stages of development. You should also always take your prenatal with food that contains healthy fats, as healthy fats help to enhance the absorption of the fat-soluble vitamins, such as vitamins D, E, and K. Taking a prenatal with food also helps to reduce nausea or an upset stomach. If morning sickness or food aversions make taking a prenatal difficult for your first trimester, then the most important nutrient to try to prioritize is methylated folate. Even on its own, it plays a major role in reducing the risk of neural tube defects. And as just a reminder, if you started your prenatal later than planned, or you're taking a more basic formula that doesn't check every box, I want you to remember you're not doing anything wrong. There's no such thing as the perfect supplement, but there are ways that you can optimize the one you're taking, and that's what this video is here to support. And remember, something is always better than nothing. And many women have healthy pregnancies and births without the ideal formulas or perfect timing. And if you're looking for more support, my website is a great place to begin. You'll find free resources like guides on choosing the best prenatal, how to boost your protein intake to meet your health goals, and pregnancy tips for PCOS. And if you're ready for a more personalized approach, explore my one-on-one support options designed to meet you exactly where you are.